Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. If you're watching us on YouTube, you know where to find us. I wanted to talk to everybody today about inflammation of the bone lining, or inflammation of the periosteum, or periostitis, right? So to think about the periosteum, think about a sausage and think about the casing of the sausage, right? So the sausage casing is a vascular, innervated soft tissue that surrounds all of our bones. That's actually where our tendons attach, right? So the tenoperiosteal junction is where the tendons grow into the bone, and that's what allows our muscles and our tendons to move our bones, right? So one of the problems with periosteum is it's very sensitive, right? It's a good and a bad thing, and it's where the muscles attach. So in general, people have a problem with their muscles being too short, right? It's not super common to see people that have muscles that are too long and too loose. So typically, people have sympathetic autonomic hyperactivity, which is caused by mental or physical stress, strain, pain, or trauma. Sympathetic autonomic hyperactivity elevates the levels of pro-inflammatory markers in the bloodstream and in different soft tissues, right? So it elevates levels of interleukin-1, interleukin-6, tumor necrosis factor alpha, C-reactive protein, which is made by the liver, right? So all of these substances get elevated in our body when our sympathetic nervous system gets elevated, or our fight or flight response. Those pro-inflammatory markers cause lots of static inflammation, or non-active inflammation. So inflammation over anything past a couple of days is not helpful, right? So that is bad inflammation where the blood is hypoxic. There's a whole bunch of excess pain amplifying chemicals. The proteins get all sticky and nothing works right? So if anybody's ever been whacked in the shin really bad, or hit with a hockey stick or something like that, and your bone gets bruised, that takes forever to get better sometimes, right? Same thing happens with surgery, especially any surgery that's involving putting screws or anything into your bones, like I've had down in my hip. That's going to cause a huge amount of periosteal inflammation. And in my opinion, periosteal inflammation is one of the things that really drives recurring chronic conditions, including just generalized chronic pain, headaches, pelvic floor pain, epicondylitis, right? If your muscles get short, just think about a rope. And then think about that rope after you tie 5 knots into it. Well, that's exactly what happens with our muscles when they get knots in them, right? So when your muscles get tight and aggravated and you have those really sore spots, the trigger points in your muscles, that is a bunch of sarcomeres, or the smallest functional unit of a muscle that we can see right now, the sarcomeres. That's a hypercontracted bunch of sarcomeres that are really hypoxic. So if that happens and our whole muscle gets short, when we go to move our bones around, that's a lot of excess tension on the periosteum, and it gets inflamed and it gets aggravated. And an issue with the periosteum is obviously it's the bone lining. It's the deepest layer of soft tissue that we can treat as physical therapists. And the only way to directly treat any tissue in the body, aside from the skin, is with a needle, right? Or is the only way the physical therapists have available to them. So that the only direct treatment of the periosteum that we can perform is with a needle, and it's extremely helpful, right? So those chronic conditions that can be very, very difficult to get over, like plantar fasciitis, headaches, epicondylitis, pelvic floor pain, again, low back pain, a lot of those, the driving factor behind being able to get most of the way better, but it just always seems to come back. I think that factor a lot of the time is the inflammation of the periosteum, which we just can't treat without needles. So nice, healthy periosteum should feel really hard, like harder than this wood, right? It should feel like a steel plate, like the needle's hitting a steel plate. When the periosteum gets inflamed, think about a sausage casing, and the inside of the sausage is the bone, the casing is the periosteum, and then think about taking a syringe of fluid and injecting it in between the casing and the stuff on the inside. Well, that's basically what happens when we get inflammation in the periosteum, and you can feel that with the needle. It's sticky and mushy and tacky, and it tends to hurt because we have amplified pain sensation when it gets inflamed, right? So inflammation of the bone lining is very, very detrimental to muscle health, our ability to contract and produce force in our muscles, right? It's a primary reason that people have muscle weakness. It's not that the muscles can't contract and can't produce enough force. It's that they're being inhibited from doing so. And then we also have at the periosteum, inside the muscle tendons, we have the little organelles in the muscle tendons, like the Golgi tendon organ, the muscle spindles, all those things have a ton of little receptors in them that pick up and get inhibited from picking up signals by inflammation in the bone lining, because that causes inflammation of the periosteum. That degrades the muscle's ability to contract. It causes pain and all sorts of different problems, elevates the sympathetic nervous system, right? So too much inflammation in the body is a chronic sign of sympathetic autonomic hyperactivity, and that is one of the major underlying causes of all autoimmune diseases, all sorts of different problems, is that our general nervous system is dysfunctional from a whole bunch of different factors, right? Nutrient deficiencies, energy deficiencies, too much pathologic tissue in the body, creating an energy deficiency, right? So the more tissue pathology, the more inflammation we have in our body, that's sucking energy away from the autonomic nervous system and keeping energy away from our body and our brain from using the innate healing powers that they already have, right? So it's not that our body doesn't know how to heal, it's that all these extraneous factors like too much soft tissue aggravation and other things are distracting the nervous system from being able to work how it should. So if you can go in and directly treat the periosteum that's inflamed, along with treating the muscle bellies in the parasympathetic autonomic nervous system, right? Because we want to push the sympathetics down to get more autonomic nervous system homeostasis. If you do all that along with removing as much tissue pathology throughout the body, and then if you really want to make a big difference, eat well, exercise consistently, right? Try to get enough sleep. All these things are simple, cheap, easy ways that can get rid of a lot of chronic symptoms. But specifically for periosteitis, the best treatment that I've ever seen, and it's very, very quickly effective, is dry needling combined with joint manipulation, right? To put the autonomic nervous system back towards homeostasis so the body can heal itself. I see months-long or years-long bone bruises go away very, very quickly when you start to implement dry needling. It's super helpful for athletes, your regular general public. It's very, very helpful. I've written a handful of articles on this, so you guys check us out. You can check out our blog page on our website. Obviously, if you're watching this on YouTube, you know where to find us. Let me know if you have any questions about anything. Thanks.